Have you ever pushed yourself, really pushed yourself in a workout or maybe deep into a game? You get to that point where everything just aches, your head feels a bit foggy, and every single movement just feels, well, a little off.
Oh, yeah, that feeling when fatigue completely changes the game.
Exactly. It changes everything. Now, what if that same exhaustion wasn't just making you feel wiped out, but was also subtly, maybe even dangerously, messing with your body's mechanics, increasing your injury risk without you even noticing?
It's a very real thing and often underestimated, I think. The body's knack for maintaining those optimal, protective movement patterns really does degrade under fatigue, especially if there's an underlying weakness already.
And that's exactly what we're diving into today. Our mission is to explore these hidden dangers of fatigue, looking specifically at people who've had ankle injuries in the past. We're going to unpack some really fascinating new research. It sheds light on how our movement strategies, the way our bodies move, fundamentally change when we're pushed to our limits. And crucially, what those changes actually mean for injury prevention.
And this is important work because it goes beyond just observing. It gets down into the precise biomechanical shifts happening, which is absolutely vital if we want to develop better, more targeted ways to prevent injuries and rehab them effectively.
Yeah, makes sense. So we're dissecting a really insightful paper today. It's titled Impact of Fatiguing Exercises on Movement Strategies in Chronic Ankle Instability, Lateral Ankle Sprain Coopers and Controls. Quite a title. It's authored by Hyung Jeon, Inje Lee, Hyunsoo Kim, Heeseong Jeong, Sunghe, Byong Kim, and Se-Young Lee.
Good team.
It was published in the Journal of Sports Science and Medicine, that's volume 24, pages 116 to 127, dated March 1st, 2025. And if you want to find it, the DOI is https://doi.org, 10.52082 JSSM.20.025.1116.
The way they designed the study is really effective, too, because they brought together 3 distinct groups to compare during these pretty demanding physical tasks.
Okay.
Which lets you get a really detailed look at how, injury susceptibility and recovery might actually differ between people.
Right. Let's define those groups, because knowing who they studied is pretty central here. First up, we have the chronic ankle instability patients, or CAI patients.
Yeah.
These are folks with a history of recurrent ankle sprains. They often talk about that persistent kind of unnerving feeling of their ankle just giving way.
Then you've got the lateral ankle sprain Coopers, the LAS Coopers. Now, what's so interesting about this group is they've had a significant ankle sprain, just like the CAI group.
Okay.
But they've managed to return to full activity without those ongoing problems. They've successfully coped with it, hence the name.
Okay. So they had the injury but recovered well. And finally, the benchmark group, the healthy controls.
Right. People with no history of ankle injuries at all.
So the big question driving our deep dive today is, how do these 3 groups perform under fatigue, specifically when doing single leg landings? And what does that tell us about preventing injuries and maybe refining how we approach rehab?
That's the core of it.
Okay, let's start with the foundation then.
Yeah.
Chronic ankle instability itself. We know lateral ankle sprains are super common, right?
Yeah.
Sports, clumsy steps, whatever. But what happens when that initial injury kind of snowballs into something more persistent, like CAI?
Well, that's a critical point. A lateral ankle sprain, LAS, it's one of the most frequent sports injuries out there. But the concern is that for quite a few people, it doesn't just heal and go away.
Right.
It can actually progress to CAI. And that's a recognized pathological condition. It's characterized by this cycle of recurring sprains, ongoing pain, swelling, and that really destabilizing feeling of the ankle just giving way. And this chronic instability, it's not just about discomfort or limiting activity. It can seriously impact quality of life and even down the line contribute to major issues like early onset post-traumatic ankle osteoarthritis.
So it's way more than just having a weak ankle. It sounds like it can send ripples through their whole movement system.
Precisely. And patients with CAI, they often develop these altered movement strategies. It's like a compensation. They instinctively start relying more on their proximal joints.
Meaning?
Meaning their hip and their knee. They try to find stability higher up the kinetic chain because the foundation, the ankle, feels shaky.
Okay, that makes sense.
Yeah, and previous research has shown this again and again. These kinetic changes, things like reduced knee extension moments, increased hip extension moments, they lead to very different movement patterns compared to healthy folks.
So the body's adapting, but it sounds like maybe a trade-off, a solution that might have its own downside.
That's a really good way to put it. And this is exactly why studying the Copers is so valuable. Remember, they had a bad sprain too, just like the CAI group.
Right.
But they recovered fully. no ongoing symptoms. So by looking at them alongside the CAI patients and the healthy controls, this research can really help us pinpoint the specific mechanisms that differentiate between chronic problems and full, resilient recovery. It helps understand why some people cope and others don't.
Okay, now this is where, for me, it gets really interesting. We're talking about these altered movement patterns, fine. But what happens when you add fatigue to the equation? I mean, I know personally when I'm exhausted, my form goes out the window, my movements get sloppy. Does this study basically confirm that, especially for people with CAI?
Absolutely. Fatigue is just this huge, yet often kind of sidelined factor in sports injuries. Study after study shows injuries are roughly twice as likely in high-level sports when athletes are tired.
Twice as likely. Wow.
Yeah. And more severe injuries often happen later in games, the final minutes when fatigue really takes hold. Now, the real strength of the study is how they induced fatigue. Well, unlike a lot of older studies that maybe use localized fatigue protocols, like just tiring out one muscle group with a simple task, this research used a protocol designed to mimic actual sports.
Okay, that sounds much more relevant to real life.
It is. It really boosts what we call the ecological validity, makes the findings more applicable. This protocol involved cycles of forward, side, and backward running, L-shaped running, side hops, cone jumps, tuck jumps.
Wow, that's comprehensive.
Yeah, it reflects the dynamic, multi-directional, high-impact nature of many sports, much better than just, say, doing calf raises until you're tired.
And how did they make sure people were genuinely fatigued? Because feeling tired can be pretty subjective, right?
They were very meticulous. They measured both rate of perceived exertion, RPE, that's the subjective scale, and actual heart rate, HR.
Okay.
Participants kept going through the cycle until their RPE hit 17, which is classed as very hard, and their heart rate reached 85% of their age-predicted maximum.
So objective measures, too.
Exactly. And the results showed they definitely got there. The average RPE ended up being around 17.89, and heart rate was up at 96.1% of max on average. So profoundly fatigued.
Okay.
This rigorous approach really makes the findings relevant for athletes and anyone dealing with fatigue in demanding situations.
So to capture the effects of this fatigue, what was the actual test? How did they measure the movement changes?
So all 60 participants, 20 in each group, remember, did single leg drop landings. They did them before the fatigue protocol and then again after they were exhausted.
Before and after. Got it.
And the researchers used 3D motion capture systems to analyze the kinematics, that's the joint angles, how the body segments move, and the kinetics, which are the joint moments, the forces acting on the joints. They looked closely at the hip, knee, and ankle.
Okay, tracking everything.
Pretty much. This let them precisely map out how the movement patterns changed under that stress.
All right, let's get to the results then. What did the study actually find when these groups did those single-leg landings while fatigued? What really jumped out about how the CAI patients moved differently?
What really jumped out were the stark interaction effects, how CAI and fatigue combined. When they were fatigued, the CAI patients showed these distinct and frankly, quite concerning biomechanical changes compared to both the copers and the healthy controls. It painted a pretty clear picture of increased risk.
So their body's default way of handling that landing load was measurably different, and not in a good way.
Exactly. Let's break down what we call proximal joint compensation, and like you hinted at, its potential cost. So at the hip, the CAI patients, after getting fatigued, showed an increased hip external rotation angle.
Okay.
And also an increased hip external rotation moment. This points towards an even greater reliance on a hip-dominant strategy to try and find stability, particularly just before they hit the ground in that pre-landing phase.
So the hip's working harder to stabilize things.
It seems so. But while that's the body trying to compensate, it might be shifting the burden somewhere else in a way that's not ideal.
And where did that burden shift? Or what other risks popped up further down the leg?
This is critical. At the knee, the fatigued CAI patients showed an increased knee valgus angle. That means their knee tended to move inward more.
Ah, the dreaded knee valgus.
Precisely. And that was combined with a decreased knee valgus moment. Now, this is a really significant finding because increased knee valgus is a well-known predictor for ACL injury risk.
Right.
So it strongly suggests that this hip compensation strategy, while maybe helping the ankle feel stable, could actually be messing with the knee's mechanics, potentially upping the risk for other serious injuries further up the chain.
Wow.
They also showed increased hip and knee extension moments, which basically indicates a stiffer landing pattern. They're not absorbing the shock as well.
So less shock absorption, more inward knee movement. Sounds like a risky combination, especially when tired.
It really does. It's like trying to solve one problem might inadvertently create another, or at least expose a new vulnerability. It's quite the chain reaction.
And what about the ankle itself? The original site of the trouble. How did it fare under fatigue in the CAI group?
Well, at the ankle, the CAI patients showed a decreased ankle abduction angle and also less ankle aversion moment. Now, what that means for you, the listener.
Yeah, break that down.
It means they had more difficulty actively moving their ankle outwards or resisting that inward roll, which is exactly the motion that causes a typical lateral ankle sprain.
So they were less able to prevent the very mechanism of re-injury.
Exactly. When fatigued, this biomechanical profile indicates they just have a much harder time preventing another sprain. They're left highly vulnerable.
That's fascinating. And how did the Coopers compare here?
Yeah, what's really interesting is a contrast. While the Coopers, the ones who recovered well, actually showed defensive strategies when fatigued, like increased aversion moment and ankle abduction.
So they were actively protecting the ankle.
It appears so. Whereas the CAI patients visibly struggled to maintain that stability in the frontal plane, side to side. This really backs up previous findings that fatigue just makes those underlying neuromuscular control deficits in CAI patients worse. It makes them less stable during dynamic tasks. The Coopers, it seems, have somehow retained or developed effective ways to protect their ankle, even when they're pushed to the limit.
Okay, so wrapping this all together, what does this mean for you, the listener? Maybe you're an athlete, maybe you've rolled your ankle a few times, maybe you're involved in rehab. How do these findings change how we should think about preventing injury or getting people back to 100%?
Well, it definitely raises important questions for clinicians, for trainers, for anyone prescribing exercise, really. The number one takeaway, I'd say, is that fatigue resistance training needs to be a core focus when rehabilitating patients with CAI. It's not just about strengthening the ankle muscles in isolation. It's about improving the overall endurance capacity of the entire lower limb. The goal has to be enhancing stability during dynamic movements and, crucially, reducing the risk of rolling that ankle again or developing these other linked injuries, especially when the body is tired.
So it's not enough just to build strength. You have to train those muscles, that whole system, to function correctly and protectively, even when they're gassed. It's about building a robust, resilient system, not just patching a weak spot.
That's perfectly put. And the study strongly recommends that future interventions, future assessments for CAI patients, they really need to look at the entire lower extremity movement patterns and coordination, especially under fatigue.
That's great.
We have to move beyond just focusing on the injured joint. We need to see how the whole kinetic chain responds under stress. For instance, future research really should explore if improving, say, hip muscle strength and neuromuscular control can actually decrease the risk of rolling the ankle again.
It's like designing a really good, flexible suspension system for the whole leg. Not just fixing a flat tire and ignoring the alignment.
That's an excellent analogy. That comprehensive view is absolutely essential for building true, lasting resilience in movement.
So what really stands out from this deep dive, I think, is that for people dealing with chronic ankle instability, fatigue isn't just this subjective feeling of being tired.
Right.
It fundamentally and potentially dangerously alters their body's mechanics during really critical movements, like landing. And this leads to these compensation patterns that kind of tragically seem to increase the risk of both re-injuring the ankle and potentially causing new, maybe even more severe injuries further up the leg, especially at the knee.
Yeah. This deep dive really highlights that true athletic resilience. It isn't just about raw strength or power. It's fundamentally about the body's ability to maintain those optimal movement patterns, those protective mechanisms, even when it's pushed right to its physiological limits.
So for you listening, this knowledge really prompts an important question, doesn't it? How might understanding these really complex compensatory mechanisms that kick in under fatigue, how might that influence not just rehab programs for existing injuries, but also how we train athletes, how we prepare ourselves for any kind of strenuous activity?
Yeah.
How do we make sure our entire body is resilient, working as this truly integrated system, rather than just having strong, isolated parts?
It's a key question. And look, this was just a glimpse into this really complex interplay between fatigue and movement, but it offers some really valuable, actionable insights, I think.
Definitely.
I'd absolutely encourage you to read the full research article if you want to dive deeper into the methods and the really detailed findings. Again, the paper is Impact of Fatiguing Exercises on Movement Strategies and Chronic Ankle Instability, Lateral Ankle Sprain Copers, and Controls by Jeon and colleagues.
Right.
Published in the Journal of Sports Science and Medicine, Volume 24, pages 116-127. And the DOI, one more time, is https.ddoi.org 10-52082JSM.2025.116.
Excellent. And if you found this deep dive insightful, please make sure you follow our channel, maybe turn on notifications so you don't miss our next exploration into some more groundbreaking research.